Well, I said on my live about, 2 weeks ago, that I will be able to prove what I'm saying about the doctor diagnosing me with the prostate, the biopsy, and how it was misdiagnosed. Because I spoke to this with my primary care doctor. I spoke to him about it. He was the one that gave me the result that there was nothing, and that it was unbelievable that that doctor would tell me that. He couldn't understand it, and I said that I would go back on November the 1st, and that I would record my doctor telling me that, so I could get VINY and everybody else to shut the fuck up about it, because I come with receipts. I come with receipts. And Simon even said, a doctor won't tell you that. Simon, old school Simon. He said, a doctor won't tell you that unless it's true. Yes, they do. They misdiagnose all the time. So I got a few minutes of me and her just playing around here on this little, because I did it with TikTok. But then the doctor comes in and we discuss it. And then all of you can shut the fuck up about that. Enjoy. Enjoy it. Hey, shithead. You ready for another cancer scare? Here I am at my fake doctor's office. Ready for another fake cancer scare. How about that? Oh my God. Jerk it. Oh yeah. Look, it's the fake diagnosis clown.
Representative about your health plan options. Hello and welcome to card service. If this is a medical emergency, please hang up and dial 911.
Hang up and dial 911.
16-digit card number.
Before this skeleton gets you.
4450505
Nicole.
5247.
I am an ogre.
Press 1. If this is not correct.
Tell me about it, baby. You tell me about it?
Where are we going from here?
Straight to hell.
You already went there.
I know, it's hot down there, too. This a tongue thing? You stupid. This is the office that I was sitting in when he told me I didn't have nothing to worry about with that prostate cancer. This one. Remember, you were here.
I think so.
Well, we'll see. Go ahead and pick your face apart.
I am.
Let me see your tattoo. Show it to me.
Which one?
The one on your hand.
This one? That
Yeah,
doesn't
let me
look
see
right.
it. It does look right.
No, it doesn't.
See if anybody can tell what that is.
Probably not.
Cutie pie.
Ugly fly.
Cutie pie.
Ugly fly.
You're not ugly. You're cute. You get good kisses, don't you, baby? Thank you for
There
that.
you go.
Is that a kiss for me?
Yes.
Thank you. It stinks. Smells like bologna and cheese. This is in my fake doctor's office. We had this built just so I could fool people on YouTube. Hear me? It's fake. It's all fake. What's up? What'd you do?
I farted.
You know it's love when you pass the fart barrier, baby.
Right. So you're on the cholesterol medication, so we should stay with that. You're on 2 different blood pressure meds, a low dose of lisinopril and hydrochlorothiazide.
That actually has worked.
Has it? Okay.
Yeah, it brought it down. The lisinopril, when he added the lisinopril to
Yes.
that, it actually keeps me pretty
good.
low.
Mobic, which is an anti-inflammatory, is similar to ibuprofen.
What's the name?
Mobic,
I mean-
meloxicam,
Yeah, you put me on that for my back.
Robaxin,
Yeah.
which is a muscle relaxant.
Yeah, that works.
Okay, so we'll keep those. Niacin, it's a vitamin you take at bedtime for cholesterol.
Yeah, I have to get that over the counter, but I
I
didn't.
got him over the counter because the pharmacy won't cover it.
That's fine.
Yeah, well, a lot of the time I tell the patients, meds like that, kind of compare the price, what your pharmacy might pay for over the counter, because some of the times I see where it's cheaper to get over the counter than to pay the copay of what the insurance pays.
Yeah, it was like $20.
I do a cranberry supplement over the counter.
Yeah, that's the way to go.
Yeah, they
Then-
won't cover
Then
that.
there's a couple of them on there.
And then Tamulosin, Flomax, that's for overactive bladder.
Right, for the prostate thing, right?
Yes. And then you take potassium by Dr. Spencer.
Yeah, that's for the kidney.
Yeah.
And he said I was I was dehydrated.
Okay.
He said that's what the cause of that was. I was just not drinking enough water.
Okay. So that's pretty much it.
That's a lot, but I'm also on Vistaril and another one too that they added.
Okay.
And I was just wondering, it's like 14 pills in one shot.
Yeah.
I was just wondering about that.
Well, as far as these here, they're all fine. If they order the others, I would ask them to see if it's needed or not.
Okay, all right, I'll check on that. And then,
Let me see that.
yeah, this is going to end up having to be surgically removed at some point because it keeps getting bigger.
Yeah, you want to see a general surgeon? You might try to drain it, but it'd be good to see.
Right, I had it checked once before because it thought it might be cancerous. But the one doctor said, no, it's benign, don't worry about it.
I think
It sounded like the other doctor told me I had prostate cancer, and we had to find out that it was,
I know. I can't. I still, as you can, I can't believe that. Come on.
I looked into,
Jeez.
I really looked into, is there anything we could do about that type of misdiagnosis? And actually, since it didn't cause any harm, now it would be different if they told somebody they didn't have cancer and they did.
Oh, sure.
But he had me worried about that.
I would be too.
For 2 weeks straight. And I'm talking to people, I'm like, hey, I've been diagnosed with this. And so everybody's worried, and then I come back and I say, well, I talked to another doctor, it's not that. But now people are like, oh, why would you say that? Because the doctor told me that.
Right. I don't understand.
I don't understand it either. But when he told me that the kidney stones do not make you bleed red blood, I looked at her and she looked at me.
They can.
They do.
They can.
That's how I knew I had it.
Sometimes it's microscopic. I've had the kidney stones too.
Yeah, you were telling me.
Man.
Everybody I talked to, it makes you bleed.
Yeah, mine was microscopic, but, well, as you know, the pain is just unreal.
Yeah. I'm waiting on the epidural now for my back.
Sure.
They want to do that first, and then if that doesn't work, they want me to quit smoking my vape for 4 months before they can give me the fusion. No nicotine in your system before they do that.
Wow.
So that's what I'm looking at. But since I'm hearing this is just a regular,
I'll get that for you.
I wanted to see if you could take.
They might train it. It's hard to say, but I'll get a referral.
Yeah, because I knew somebody else that let it go and it just gets bigger, and then you have to cut it. Yeah. Well, this has been there for about 6 years.
Yeah.
And now it's getting to the point. Yeah, I say, hey, let's see if the doctor can do about it.
And that's how they are. They tend to come and go, larger. And
It's been there for years.
I'm glad it's not sore. That's a good
It doesn't bother
and
me.
it's not infected, right? It's just irritating.
Well, it looks it doesn't look good.
Yeah. No, I do the same thing.
And if I've got the coverage for it, I'll take it. But they're giving a hard time about covering for the epidural. I've been waiting for a month for approval from my insurance. But they've approved all these surgeries. They've physical therapy.
I know. I don't understand. Sometimes I can order an MRI of a knee or whatever, and they want to approve it, even though the X-ray was normal. Still, the pain. Where orthopedists, they can order and get it approved.
Well, that's what I say.
That's how it works.
I wonder what I could do if my insurance won't approve the epidural. How do I move forward?
Well, I would have them resubmit it to the insurance a second time.
Okay, that's a good idea.
Yeah.
Because they've covered everything. They cover physical therapy for them for twice a week.
You know, I've seen of course times where you submit it, they don't approve, you do it again, it's
had that
approved.
problem.
You know, again, it makes no sense, but it's something to do. Give it a shot.
Well, yeah. All right. So you're going to refer me somewhere else for this one?
Yeah.
Okay, that sounds good.
I got approved for Botox one time. My neurologist gave it to me.
Yeah.
They didn't get reimbursed.
Really?
So the neurology told me they couldn't do it anymore.
Yeah.
Yeah.
I know what you're talking about.
Because if they approve it and then the insurance doesn't pay them, you're no longer.
Yeah.
You
pretty
don't have
much
to
what
worry
happened
about
to
pay
me.
for it.
I got screwed.
Yeah. I know my wife was on Nexium for a long time. Went to the pharmacy and they said your insurance doesn't pay for it any longer. I'm like, she's been on a couple of years. I said, would have been nice just to get a notice of some sort.
Right,
It's
right.
crazy how they do
So we
that.
get it at Sam's now, but it's like, come on.
Now, how about them apples? You can clearly hear me discussing this with this doctor. You can clearly he's telling me that he doesn't believe he did that. We're talking about the misdiagnosis. He doesn't know he's being filmed. But receipts are very, very important around here. So for all of you who are running around saying that I'm a cancer scammer, running around saying that I just said that, and for those of you that say that doctors won't misdiagnose you, and for Vinny running around calling me a cancer scammer, eat my fucking ass. Eat my ass.